Welcome back to sqadia.com. We were talking about the musculoskeletal system. My name is Osama, and this section is about the diseases of the joints. And in this section specifically, we're going to talk about two very important diseases of the joints, and they are very common as well, especially the osteoarthritis, which is very common, and the rheumatoid arthritis. So our contents for this lecture are majorly osteoarthritis and rheumatoid arthritis. So let's start with the osteoarthritis. It is the most common, you can say, disease of the joints. Very common, and especially in the weight-bearing joints. If you look at this figure, here you can see there is actually a little bit of gray shade, which is showing that which joints are most commonly involved. And you can see that most of these joints are actually weight bearing. So there is ankle and joints of the foot, there is knee and hip. The most patients that we see every day with osteoarthritis are knee and hip joints. And there is also shoulder and hand, but most commonly is the knee and hip. So what type of joints does it involve? These are weight-bearing, and these are synovial joints. These are not a condition of the cartilaginous joints or fibrous joints. It's a condition of the synovial joints, and it is the most common type of arthritis. In fact, the most common type of joint disease. The epidemiology for this is age. Age is one of the most important risk factors. So age above 60, especially in females because of the menopause. So there's greater predisposition to develop osteoarthritis. Obesity, because obviously weight-bearing joints, greater weight means greater force on the joints, greater joint reaction force, and greater levels of risk for developing a degenerative joint disease such as osteoarthritis. And chronic joint diseases and fractures, because fractures can lead to abnormal stresses on the joint. Occupations such as farmers and repetitive use and injury. So a lot of these risk factors, if you see, are actually biomechanical in nature. So this is somewhat a biomechanical condition because it is degenerative joint disease. And what happens is that because of these risk factors, there is actually a progressive destruction and loss of cartilage with accompanying periarticular bone response. Periarticular bone response because the cartilage degenerates, it wears off, the stress transmits to the bone, and bone responses via the inflammation, and this is actually a response of the bone to trauma or injury which is occurring at it because of the increased friction. Increased friction is there because when there is cartilage, there are two types of lubrication, which is the boundary lubrication and fluid film lubrication. When the cartilage starts to disappear, the hyaline cartilage, then what happens is that there is loss of boundary lubrication and fluid film lubrication. So the bones start to rub with each other, and there is greater friction, greater trauma, greater wear and tear, and this exposed subchondral bone becomes sclerotic because of continuous friction and degeneration. And when it becomes sclerotic, in an attempt to heal itself, there is increased vascularity, and because of increased and uncontrolled healing, then there are cyst formation and osteophyte formation and lipping at the joint surfaces. And you'd also see that there is a decreased joint space on an X-ray, as you can see in this picture here. So there is decreased joint space, exposed subchondral bone, and worn out cartilage. Then what happens is that attempts to repair cartilage growths results in osteophytes, as I just said, and there's also lipping of the joint surfaces. The symptoms of osteoarthritis include joint pain, which is increased with movement because movement results in friction, and there is actually an deficient fluid and boundary lubrication mechanism resulting in greater friction and thus pain. Stiffness after rest, because whenever a person moves, an inflammatory process starts, and during rest that inflammation process is running, and then that leads to stiffness. So stiffness indicates that there is an inflammatory process. Maybe that is why it is also known as osteoarthritis. Arthritis means inflammation of the joint. And there is actually, in the longer run, there is deformity of the joint and enlargement of the joint because of recurrent wear and tear and attempt to heal the joint. So deformity and muscle wasting because of the pain in the joint and degeneration in the joint. There is reflex inhibition of the stabilizers, such as if I talk about the knee osteoarthritis, it is always accompanied by reflex inhibition of the vastus medialis muscle, so muscle wasting as well. Other reason for muscle wasting is because there is pain on movement, so the activity of the patient decreases. So because of decreased activity, so there is hypertrophy of the muscle because of disuse, also known as disuse atrophy. Other than that, you can see that the patient would be having crepitus. That is also because of uneven joint surfaces. The joint surfaces are not congruent anymore, and there is also presence of Haberdin's nodes and Bouchard's nodes. So Haberdin nodes are at the site of distal interphalangeal joints, and Bouchard nodes are at the site of proximal interphalangeal joints. Now, this is an example of an X-ray of the knee joint and osteoarthritic knee joint. So as you saw in this slide, that there is deformity. So you can see that there is deformity. Both the sides are not equal. They are not the same, as you can see with the joint space. So there's more joint space and there's lesser joint space, which means there is greater contact and greater stress at this area, and obviously decreased joint space, which means failure of fluid film lubrication, as well as sclerosis of subchondral bone. And as you can see, there is lipping. Here you can see there is lipping of the joint surfaces, also known as osteophyte formation. So this is what actually happens in osteoarthritis, and the patient is in a lot of pain, and we have to be very careful with these risk factors here so that we can decrease or minimize the occurrence of osteoarthritis. The other condition, very popular, which is known as rheumatoid arthritis. This, on the other hand, is autoimmune disorder in which there is symmetric polyarthritis. As compared to osteoarthritis, that was not symmetric. It is possible that a person would have osteoarthritis in the right knee, but no osteoarthritis on the left knee. But rheumatoid arthritis, on the other hand, is systemic. It is autoimmune, so it is symmetrical. For example, the small joints of both the hands would be involved, and not just one hand. But the prevalence of rheumatoid arthritis is very less as compared to the osteoarthritis, and in the general population there is 0.5 to 1% prevalence, and the age is 30 to 50 years for rheumatoid arthritis as compared to osteoarthritis, which is actually a degenerative joint disease, and the peak prevalence is after 60 years of age. So the risk factor for rheumatoid arthritis are women before menopause. It can also be familial, it can be passed in families, and because there is also a genetic predisposition, the gene which is identified for rheumatoid arthritis predisposition is the human leukocyte antigen. And the characteristics of rheumatoid arthritis include synovitis, which means inflammation of the synovial membrane, which lines the synovial joints. So which means that it would be only present in the synovial joints. And along with thickening of the synovial membrane, and because of autoimmune disorder, there would be infiltration by inflammatory cells and WBCs. So as a sort of inflammation occurs, it has to be followed out by healing. So the synovium starts to divide, it proliferates and grows over the cartilage. which is the hyaline cartilage, which is responsible for the lubrication. And when it grows over it, it grows over it like a tumor, and a pannus formation occurs, and it destroys the underlying cartilage and subchondral bone. So when it destroys the cartilage, there is decreased boundary and fluid film lubrication, and again there's greater friction, pain, and stiffness, and all of those symptoms. So as you can see, because of all of this, there's early morning stiffness indicating an inflammatory process. And if the early morning stiffness is greater than 30 minutes, it is obvious that it is a risk, or it is a suggestion for rheumatoid arthritis. There's joint swelling because of active rheumatoid arthritis episodes. And in all of this process, there's also a weakening of the capsule. So capsule is responsible for stability of the joint. And when there's weakness of the capsule, the joint surfaces would not be able to line themselves as they used to in the presence of a healthy joint capsule. So what happens then, the joint surfaces would not be congruent to each other, and they may subluxate, and that subluxation can lead to the development of deformities, as we would see in pictures in the upcoming slides. There is no specific treatment or no curative treatment for rheumatoid arthritis. The treatment goal is actually focused on the remission of symptoms instead of modifying the condition. And one thing that can be used in identifying rheumatoid arthritis is the rheumatoid factor, which is positive in 70% of the cases. But that is not the only thing that we should be concerned with, because rheumatoid factor may also be positive in some connective tissue diseases, not only in rheumatoid arthritis. So you cannot just say if that there is a positive rheumatoid factor, it is 100% rheumatoid arthritis. Here you can see the pictures, and this is a normal joint. So this is a joint capsule, and this is the synovial joint, and this is the bone and cartilage. And here you can see that there is inflammation. So inflammation of the synovial membrane, and along with the weakness of the capsule and enlargement of the joint. And here you can see that the joint space is reduced, similar to the osteoarthritis. And loss of cartilage. Reduced joint space means reduced fluid film lubrication and erosion of the bone as well. So overall degenerative symptoms. And how does it appear? Here you can see some of the common deformities that are observed in rheumatoid arthritis. Here you can see this is the metacarpophalangeal joints, and you can see there is an ulnar deviation deformity at the metacarpophalangeal joints, and you can also see deformities at the level of interphalangeal joints, proximal and distal. So here you can see that this is a botanier deformity at the level of interphalangeal joints, and here you have a swan neck deformity at the interphalangeal joints. So these are some of the deformities which are observable in rheumatoid arthritis. Now, sometimes it is possible that there may be a mechanical reason for joint disease as well. As we talked about the postural syndromes in the section of the disease of the muscles. So postural syndromes involves muscles, and there are actually abnormal symmetry of the muscles, or abnormal length and tone of the muscles, which leads to pain and discomfort. And if a person is in a prolonged state of postural syndrome, it may lead to dysfunction or derangement syndromes. Dysfunction syndromes represent themselves in the form of joint pain or joint-related symptoms, which are having pain, severe pain, or it has a characteristic of severity. Like, for example, if I am having pain in my back, I extend my back, I start having pain, so pain is severe, but as soon as I come back, the pain disappears. So pain is only aggravated when I do that movement, and as soon as I come back, the pain disappears. So that is a dysfunction syndrome, such as facet joint syndrome in the lumbar spine. On the other hand, postural syndromes can also lead to derangement syndromes, in which the nature of pain is irritable. And what happens is that, for example, if I'm flexing at my lumbar spine, I'm bending forwards, I would not feel pain. But if I do that repeatedly, I would start having pain. So it is coming after some time. So it was not severe and spontaneous. It is coming in a little bit of delay. So that appears after sometimes I perform that movement, and even if I stop performing that movement, that pain stays. So it was slower in onset and it takes time to disappear as well. So this is known as a derangement syndrome, and derangement syndromes example include, which is very common, discogenic low back pain, which involves disc prolapse, which also known as posterior intervertebral disc prolapse, which is very common. So we learned about osteoarthritis and rheumatoid arthritis in this section, which was diseases of the joints. Thank you for watching. sqadia.com.